Sherry Beatty loves spending time with her rescue dog, Lily, but her irregular heartbeat limits what she can do.
It's like a washing machine that's off balance when it's in the spin cycle. Like it just beats faster and odd. The fatigue, shortness of breath.
After waiting almost a year, she was finally scheduled for a cardiac procedure to fix the problem at the end of March. Then it was abruptly canceled due to COVID-19. Her husband Jim suffered a heart attack in February and had bypass surgery in March, just under the wire. The most urgent cancer and heart and stroke procedures have continued, but an estimated 15,000 to 20,000 cardiac procedures have been postponed, according to the Canadian Cardiovascular Society. When you factor in everything else that stopped, from cataract surgeries to hip and knee replacements, the surgical backlog could add up to as many as 100,000 patients across the country.
The surgeons have been most worried, and they're just seeing these waiting lists growing, and anxious patients are phoning back and worrying and so on.
There is a glimmer of hope, but it's fragile. University Health Network in Toronto is starting to perform a few more cancer surgeries and organ transplants this week. If it can continue ramping up, the surgeon-in-chief hopes to catch up on time-sensitive surgeries by the fall. But to do that, hospitals need government funding to run operating rooms during evenings and weekends, a reliable supply of personal protective equipment, and COVID-19 test kits for every patient before undertaking surgery. And if COVID-19 cases rise again, surgeries will ramp right back down. So the best way to restore surgical procedures for people like Sherry Beatty? Continue following public health guidelines, like staying home. Nicole Ireland, CBC News, Toronto.